Just moments ago, the death toll climbing to 105 cases across the United States. 6 people have died, all in Washington state, 4 of them residents of a nursing care facility near Seattle. Tonight, more firefighters in that area have been put into quarantine after responding to coronavirus calls at the facility. We'll go there live in just a moment. At the White House, President Trump defending the administration's response. Vice President Mike Pence in the first of what he says will be daily briefings from his coronavirus task force. Call this an all-hands-on-deck effort. We begin our special coverage. CNN's Nick Watt in Los Angeles. So, Nick, some major developments tonight.
Yeah, there have been. Listen, Anderson, up until this point, the focus has really been on the west coast of this country. 20 confirmed cases here in California, 3 in Oregon, and 18 up there in Washington state. But just within the past hour, we have heard of 1 more case from Massachusetts, somebody who'd been on a school trip to Italy, and 2 more cases in Georgia. Those people, we're told, are being held in isolation in their home while authorities try to make sure that they weren't in contact with other members of the community before their diagnosis. But you mentioned that White House task force this afternoon. The one message that came loud and clear out of that, Anderson, there will be more cases here in the United States. 6 now dead in Washington state. 4 of them elderly residents of this nursing home near Seattle. At least 48 schools now closed across the state for deep cleaning, and a warning from the governor.
We think folks should begin to think about avoiding large events and assemblies.
Today, nationwide, we topped 100 known cases across 12 states. Known is the key word. There are likely many more.
Right now, today, on this day, Monday, if you look at the country as a whole, the risk is low.
But the virus is now spreading within American communities.
The degree of risk has the potential to change quickly.
Today, the first confirmed case in New York, the nation's most populous city.
There is no doubt that there will be more cases. This is New York. We're a gateway to the world.
Travel restrictions are now in place to and from some global hotspots.
We'll ensure that anyone traveling on a direct flight to the United States of America receives multiple screenings at all airports in Italy and South Korea.
But of course, the virus is here already, and the enhanced testing that will be going on in the next week or 2 will help us define exactly the nature and extent of the problem that's here already.
Earlier in this outbreak, criticism, not enough test kits, too few labs, that, we're told, is changing.
The estimates that we're getting from industry right now, by the end of this week, close to 1 million tests will be able to be performed.
But one growing concern, what to do with those who've tested positive or the potentially infected. Up in Seattle, the county is buying a motel to isolate them. And after that deadly outbreak at the nursing home.
And we have 2 police officers and 27 firefighters that are currently in quarantine because each of them responded to an incident at the Life Care Center in the past 2 weeks.
Tonight, the city of San Antonio suing the federal government after an evacuee from Wuhan, held in quarantine at a nearby base, was released and later tested positive. This judge just issued an emergency order.
Anyone coming out of there, which is 120 of them left, come out into the county, we will prohibit that, and the sheriff's office will detain them if that were to happen.
The plan going forward for the country?
Prepare for the worst, hope for the best.
And a promise from the White House task force to keep us informed.
We'll be back here every day. Get used to seeing us.
Interestingly, we just got the White House schedule for tomorrow. They will be having one of those briefings, but Anderson, it will not be on camera. Now, testing is going to be the key going forward. Interesting thing about this virus, for 80% of people who get it, it's pretty mild or asymptomatic, which in one sense is good news, but it makes it harder to contain. There could be many people walking around right now. They don't know they've got it. They are shedding that virus and infecting other people who might be affected more badly than they were. So the testing will be key, and that is going to be rolling out within the next few days, we are told.
Nick Watt. Nick, I appreciate it. Earlier in the program, I believe I misspoke. I just want to be clear. There are 105 cases in the United States, known cases of people who are infected. There have been 6 deaths in Washington state. 6 deaths total in America more than 105 cases, more than 105 people known to be infected. Where are we on this big picture?
Well, I mean, you know, the numbers do continue to grow. I think people are hearing, some people are sort of hearing about this, waking up to this now for the first time because it's sort of been plodding along, and then we're starting to see this increase in numbers and obviously, sadly, the increase in deaths as well. Public health officials, they anticipated this. This is not a surprise to them, despite how much has been going on in China for some time. The idea that eventually this virus, which, you know, doesn't respect boundaries or borders, it's a little strand of RNA, was going to come across the oceans and travel around the world, that was sort of known. What I think is going to be interesting now, because what's going to happen this week is a lot of tests are finally going to go out. And I know we're going to talk about testing. There's been inadequate testing. But when this testing goes out, I think we're going to see a sudden jump in numbers.
Because there's a lot of folks who may be asymptomatic, who are not showing signs of having it.
That's right. And so it's bad news, good news. Bad news because people are going to hear about this sudden increase in numbers. But I think it's also going to be reflective of that point exactly, that there's a lot of people out there who did not, you know, get particularly sick with this. And if you look at the data, some 80% of people really don't have much in the way of symptoms.
Yeah, I want to play something that Vice President Pence said today.
Let's be clear. The risk to the American people of the coronavirus remains low, according to all of the experts that we're working with across the government. And as the President has said, we're ready for anything, but this is an all-hands-on-deck effort.
So, Zeke, you hear them saying it's an all-hands-on-deck effort. What does that actually entail? I mean, how is this being combated? I talked to the governor there in Washington. Who's in charge in Washington for efforts there? Is it the CDC? Is it the governor?
You need more than the CDC. The CDC has one slice of the activity, but you also need the FDA because you need to have drugs and approval of devices and approval of any therapeutics that you're going to use. Homeland Security has to be involved. The State Department is going to be involved if you're going to have travel restrictions and transportation restrictions. And the other thing that you really need that I have yet to really see is you need connection to the states and localities. That's where the front line is, because the CDC is in Atlanta and they can send teams out. But the first reports are going to go to the local public health officials, to the state public health officials, and then back to the CDC in Atlanta. So the all hands on deck really requires a lot of coordination and keeping everyone in step, and that everyone includes all the states. As you heard, the governor, Inslee, you know, deciding about when to close schools, you know, what to do with the quarantine, how to manage the surge that they might need on hospitals. All of those things are happening very locally, and so you need Washington to coordinate that. When we were doing H1N1 swine flu, we were on the phone to local health officials every day, and multiple times a day.
Jennifer, I mean, the governor made an interesting point, which is that the front line of this is individual citizens and families who, you know, are monitoring their own health, their families' health, and they are the ones who will be able to prevent the spread of this from spreading even farther with a greater reach.
Yeah, absolutely. And I'm really glad that he made the point about not just kind of showing up at the emergency room. I think that could be the worst thing that we could see happening.
Explain why.
Well, I mean, first of all, we want to reserve hospital resources for the people who need it, the severely ill patients. This could play out such that we have more patients than we could possibly handle, and we don't want to clog emergency rooms and other facilities with people who are just mildly ill or just want to get tested.
That's my concern, is that emergency rooms are going to be flooded with people saying, I have a cough, can I get a test? And first of all, the governor is saying they can do 200 a day right now, but that's really not going to be enough if this, in fact, grows. Is this a Homeland Security issue? Because you know, earlier in the weeks, we saw Joe Kennedy going after the acting head of Homeland Security, who seemed surprised that he considered it part of Homeland Security, and clearly, fairly or not, the acting head of Homeland Security didn't seem to think it was part of his purview.
Well, of course it's part of his purview. It's a whole of government effort, or it ought to be, right? Homeland Security has a piece of this, but obviously Health and Human Services, CDC, the State Department, foreign aid should come into this, right? The most effective thing we can do to protect ourselves from pandemic disease is to defend forward, as I've described it, which is to help and assist other countries and to prevent those diseases before they get to our shores. So this has to be a whole of government effort, which is why it's got to be coordinated out of the White House. All of what the gaps that Zeke was talking about, that Jennifer was talking about, those are gaps that the White House ought to be identifying by working tightly and very closely with state and local officials. So I served in the White House during the Ebola epidemic, right? And we convened regularly conference calls and discussions with state and local public health officials. What are the gaps that they were seeing? What assistance did they need? And then helping to coordinate that very, very quickly. That's got to be done out of the White House across the government.
Right.